Hello, I am Dr. Puramjai, pediatrician and neonatologist at Akkineni hospitals. Childhood immunizations represent one of medicine's greatest public health achievements, preventing serious diseases like measles, polio, whooping cough, and pneumococcal infections. Following recommended vaccination schedules protects individual children while creating community immunity. Modern vaccines are remarkably safe and effective, with benefits vastly outweighing minimal risks. At Akkineni Hospitals, Vijayawada, trust you and your family are doing well. Let's go through some key insights today, so please stay engaged and make your notes.
Welcome to this explainer. Today, we are going to dive straight into the incredible, literally life-saving science behind childhood vaccines. We'll also be mapping out India's national immunization schedule. Whether you're a parent trying to make the best health decisions for your little one, or honestly just someone fascinated by how the human body works, we're going to break down the clear, evidence-based facts you need to know. Here is our quick roadmap for today. We'll cover immunological memory, the different types of vaccines, India's specific schedule, the concept of herd immunity, and then we'll finish up by busting some common myths.
All right, let's jump right into Section 1, Immunological Memory.
To truly appreciate vaccines, consider this staggering reality for a second. Historically, they are hands down the single most effective medical intervention humans have ever developed. I mean, thanks to vaccination, smallpox was completely wiped off the face of the earth back in 1980. Polio is currently right on the absolute threshold of being eradicated. And get this, global measles deaths have plummeted by a massive 99% from their pre-vaccine peaks. So how exactly does this biological magic happen? Well, it's pretty amazing when you look at our body's defense mechanism. When a new pathogen enters your body natively, your innate immune system kicks in within hours. But it's kind of generic. The real heavy lifting? That's done by the adaptive immune response. The catch is, it takes about 7 to 14 days to generate specialized T cells and those crucial antibody-producing B cells. And by the time that happens naturally, a serious infection might have already caused massive damage. But here's the brilliant part. A vaccine acts as a completely safe training simulator. It hands your immune system a harmless piece of the pathogen. Your body runs through all those exact defensive steps, creating long-lived memory cells that stick around for years. All of this happens without ever exposing a child to the actual dangerous disease. So if the real bug ever does show up, those memory cells spring into action in mere hours, not weeks.
Moving on to Section 2, let's explore the biological arsenal, the types of vaccines.
Vaccines aren't just one thing. They are precisely engineered depending on what kind of pathogen we're dealing with. First up, we've got live attenuated vaccines, like BCG or MMR. These use live but heavily weakened pathogens. They mimic a natural infection really closely, generating super robust immunity. Next, you have inactivated vaccines. These use killed pathogens, think IPV or hepatitis A. They're incredibly safe, though sometimes you might need a booster shot down the road. Then there are toxoid vaccines, like for tetanus and diphtheria, which are fascinating. They actually use inactivated bacterial toxins to train your immune system to attack the dangerous toxins themselves rather than the bacteria. And finally, we have subunit and conjugate vaccines.
Now, conjugate vaccines are an absolute game changer. You see, infants under the age of 2 just physically cannot mount an independent immune response to certain complex sugars, called polysaccharides, that coat the outside of some bacteria. So to bypass this biological roadblock, scientists did something incredibly clever. They attached those polysaccharides to a protein carrier. This essentially tricks the infant's immune system into recognizing the threat, allowing tiny babies to build strong immunity against really severe diseases like pneumococcal disease and Hib. It is just a stunning piece of biological problem solving.
All right, Section 3. Let's see how all this science gets applied in the real world with India's immunization schedule. Following a child from birth up to 6 years old, this schedule is essentially a perfectly timed biological choreography. The timing is never random. At birth, infants immediately get BCG to protect against severe tuberculosis, plus hepatitis B and the oral polio vaccine. Fast forward to between 6 and 14 weeks, and they get the pentavalent vaccine. This one is amazing because it rolls protection against diphtheria, tetanus, whooping cough, hepatitis B, and Haemophilus influenza type B all into one. As they hit that 9 to 12 month mark, it's time for the MMR vaccine to tackle measles, mumps, and rubella. And then from 16 months up to 6 years, we introduce crucial boosters. This entire sequence is designed specifically to align with the waning of a mother's passed down antibodies and the natural maturation of the child's own immune system.
Beyond that standard national schedule, the Indian Academy of Pediatrics highly recommends a few extra layers of protection. We're talking about the varicella vaccine for chickenpox, hepatitis A, and crucially, the HPV vaccine for young girls aged 9 to 14. That HPV shot is incredibly effective at actually preventing cervical cancer later in life. Talk about a massive lifelong benefit.
Let's move to Section 4, herd immunity. This is a concept we really all need to grasp because it's about the bigger picture. Herd immunity means that when enough people in a community are vaccinated, the chains of disease transmission literally physically break. The pathogen just runs out of bodies to infect. So, by vaccinating your child, you're not just protecting them, you are building an invisible shield for the most vulnerable people in your community. We're talking about newborns who are too young to get their shots, or cancer patients whose immune systems are too weak to receive vaccines.
But here's the catch. Herd immunity is not some universal one-size-fits-all number. It totally depends on how contagious a disease is, what scientists call its basic reproductive number, or R0. Take measles. Measles is insanely contagious, with an R0 of 12 to 18. That means one sick person can infect up to 18 others. Because of that, you need a staggering 95% of the community to be immune just to keep outbreaks from happening. Polio, on the other hand, requires about 80 to 85%. The second vaccination coverage drops below that critical 95% line for measles, outbreaks spark up immediately. We saw this exact scenario play out perfectly in the data during the 2019 measles outbreaks in India, which mapped directly onto districts with gaps in their vaccination coverage.
All right, final section. Let's take a minute to bust some common myths.
This first one is probably the most famous, and frankly the most frightening fear for parents. So we have to look closely at what the evidence actually says. Do vaccines cause autism?
The answer is a rock-solid, definitive no. This entire myth traces back to literally one single paper published in 1998. That paper was completely retracted because it used fraudulent data and committed severe ethical violations. The guy who wrote it even lost his medical license. Since then, scientists have conducted massive global studies looking at millions of children across multiple continents, and every single one confirms absolutely zero association between any vaccine and autism, period.
Myth number 2. Parents often look at the schedule, see combination shots like the pentavalent vaccine, and get worried. They wonder, do too many vaccines all at once overwhelm a small child's immune system?
Let's think about the actual biology here. From the minute a child is born, their immune system is fighting off millions of antigens every single day. I mean, let's be real. Babies are basically tiny crawling petri dishes who put literally everything in their mouths. Compared to that massive daily environmental workload, the total antigen load in the entire childhood vaccine schedule is just a tiny microscopic drop in the bucket. Giving multiple vaccines at the same time does not overwhelm immune function at all. Their little immune systems handle it effortlessly.
And finally, myth number 3. Some people wonder, isn't natural immunity just fundamentally stronger? If you just survive the actual disease, doesn't that build a tougher immune system? Well, surviving a disease definitely grants strong immunity, sure, but the fatal risks involved are just way too high to ever justify it. For example, a natural measles infection kills about 1 to 2 out of every 1,000 infected kids in developed nations, and that death rate can spike up to 10% in malnourished populations. The math just does not favor taking your chances with the real disease. Vaccines give you a massive biological shortcut. They provide that exact same safe, robust immunological memory, but without ever subjecting your child to the deadly dangers of the actual infection.
So we've covered a lot today. The amazing history, the elegant biology of our memory cells, the engineering behind different vaccines, the timing of the schedule, and why herd immunity matters so much. Understanding this biological machinery really empowers you. So, as we wrap up this explainer, I want to leave you with one final thought. Are we really willing to risk our children's lives against entirely preventable diseases when the ultimate biological training simulator is readily available? Think about how you'll use this science to confidently protect your family and your community. Thanks for joining me today.